Welcome everyone to another JPN and Ematai Grand Round session. Before we begin, a special thank you to Rabbi Shlomo Brody from Ematai and to Chemet Health for making the CME accredited Grand Rounds possible. Today's topic of mental health and halacha, while it's a subject that's always relevant, perhaps it's been especially relevant over the past 2 months, both for the Jewish community in Israel as well as for the diaspora. With us this morning from Israel is Rabbi Yoni Rosensweig, Rabbi of the Netzah Menashe community in Beit Shemesh, Israel. Previously served as Rosh Hashiva of Yeshivat Yisrael in Efrat. Rosensweig is the author of several books, including his recent book, Nafshi-Bisheelati, a book on the intersection of Jewish law and mental health. Without any further ado, Rabbi Rosensweig.
Thank you very much. Really appreciate it. So I'm not going to waste time with too much introduction. We should just get into the content immediately. For those who don't know, in the last 5-6 years, I've been dealing with issues of mental health in the Jewish community, not from a practical perspective at the beginning, more from a halachik perspective. Like many people deal with, there are plenty of issues, whether it's violence in the family and other things, etc., which touch upon mental health. I'm not talking about that. I'm talking about questions that I got, questions that people have, how to live a Jewish life, an Orthodox life, with mental health challenges. And that has to do not only with halacha, also with machshava, also philosophical questions that people have, but sure, also with halacha for sure. And that's what we're going to talk about today. I'm going to break up my talk into the following 2 parts. Okay, the first part will be just like, I'm going to start off with a few examples, cases, right? What is mental health and halacha? Sometimes people ask me, although I have a feeling that the people here don't need that introduction. But nevertheless, I will give a few of the examples that I get from people. And then the bulk of the shiur, of the presentation, will be to try and figure out what tools, what sources the halacha gives us in order to be able to tackle these questions, and how we can conceptualize these issues. And then at the end, we'll try and see what that means practically in the different cases that I have brought forth. Should I be leaving some time at the end for questions?
If it presents itself, yeah, that'd be great.
Okay.
But we'll see where the audience is.
Okay, fine. So I'll give the presentation, and both throughout and at the end, you're welcome to write in the chat at the end. If you also want to open your mics, and that's also fine. The name of the new sefer is Nafshi Beshe'elati. It is available on the Koren website. Maybe you can put it on for them. Yeah, okay. He'll find it and he'll put it on for you. Don't worry. All right, but yeah, it's easily available. It's in Hebrew. It's going to be coming out in English in a few months. I don't have an exact date for you yet. The war kind of put hold on certain things. So while I thought it would be done by much the beginning of 2024, that's not going to be the case. But we will see. It will be done in the first few months of 2024, but I'm not yet sure exactly when. In English. Right now, it's only available in Hebrew. Okay, so when I talk about halacha and mental health, what do I mean? Questions that I get very greatly. Okay, so the questions that I'm sure that many of you are familiar with are OCD questions, right? Chazal always say, "Hakol talui b'mazal, afilu sefer Torah shebaychal." Right, even a sefer Torah, which is very important, can many times just be gathering dust in the Aron Kodesh, while its counterpart is being taken out every Monday and Thursday and being read from. Everything depends on luck. Yeah, even a sefer Torah's luck, it can change from case to case. It's true also for mental health. Some mental health conditions are more lucky, so to speak, in that they are more famous or more well-known, and certainly also within the context of our discussion of halacha. So if I say halacha and OCD, I'm pretty sure that everybody understands what I'm talking about. Whether it has to do with excessive washing of hands, whether it has to do with vowing, when a person vows constantly, and thinks that everything that they think that it crosses their mind, they're going to have to do. Professor Israel Strauss from Ma'anei Yeshua once, related to me a question that he got, or rather a case that he got, of a person who thought that he was married to thousands of women, because according to Hilchot Kiddushin, in the Gemara in Kiddushin, he thought that every woman that looked at him and enjoyed his handsomeness or his Torah learning or whatever it was, etc., was basically agreeing to be mitkadish to him according to a certain Gemara and the way that he read it, which is another example of, OCD. I had a question about OCD. I have questions of OCD about, nida all the time, nida and mikvah, which come up once again very often. Lately, 2 questions about repeating words during davening again and again and again, and whether a person has kavana during davening properly, and should they repeat again and again and again. Those kinds of questions. There's a woman who contacts me about avodah zara, out of an OCD perspective. She thinks that every time she sees like any sort of line and a line that crosses it, right? Even behind me on these, like, in this cupboard over here, right? You can see like a line down and then a line that crosses it. It's a cross. Every time she sees a cross, she thinks, like that's a problem. I'm over the avodah zara. What do I do in that situation? Kashrut questions, of course, in OCD also come up, etc., etc., etc. There's certainly many questions with OCD. So those are a few examples of halacha and OCD, but not just, right? Depression as well. I get questions about using your phone on Shabbat, watching on Shabbat, using all kinds of coping mechanisms in order to get through, taking a shower on Shabbat, with depression, right? All those sorts of things where a person has coping mechanisms, he's trying to figure out whether he can use them or not, right? Those things come up. Today, I got a very interesting call. I never received this sort of call before. A woman wanted to know whether it was ethical for her, due to her depression, to bring a child into the world. She already has a child. She's married, already has a child. She wanted to know whether it was right for her halachically, ethically, spiritually, to bring another child into the world. She currently has very passive ideation, suicidal ideation, but it's it's flared up in the past, and she wanted to know whether, concerned that she might die, someday at her own hand. She wanted to know whether it's right for her to bring children into the world, yes or no. That was the question that I was asked today, right? So questions of depression, and once again, I always say, and I'm sure you know this, it's like you don't even know where the next question is going to come from. Like with OCD, I assume that some of the questions you're like, oh yeah, heard that one, could have anticipated that one, etc. With depression, with a lot of the other ones, you can't anticipate. There's no way to anticipate where it's going to come from, right? So depression, right? Those sorts of questions for sure. Anxiety as well, surrounding Shabbat observance. Shabbat, once again, things that I'm sure you know. Shabbat observance is very hard for those with mental health challenges. Very, very hard. The usual coping mechanisms, their usual things that keep them afloat, many times are taken away on Shabbat, which is why I get many questions about using a phone on Shabbat. Can they, can't they? Driving on Shabbat, caring for someone with ASD, with autism on Shabbat. What if they have, assistive technology that they use? What if they just need to go? What if they're very violent? If they don't have, screens? What if what if they need to go for a ride? That's the only thing that calms them down. So questions of, with autism, even things a bit more, so to speak, I don't know if exotic is the word to use, but a little bit out of the way. Trichotillomania, hair pulling disorder. I've received questions. Once again, they have to do with a coping mechanism. One young woman who asked me, she realized that she can stop pulling her hair if she sews on Shabbat, or she sews during the day, whatever. So we wanted to know if she could do it on Shabbat also to stop with the hair pulling. There was an avrech, there was a married man out of Har Etzion, the yeshiva, who would pull on his beard, and he would tell me that the only way to stop that, he realized, was to chew gum. He wanted to know if he could chew gum on the fast day, right? Is there a difference in Tisha B'Av, Yom Kippur, smaller fast days, etc., etc., etc. So once again, it just keeps on going, right? So I could continue on with questions of bipolar, and questions of PTSD, and questions of schizophrenia, questions about whatever. There's just so many things. So I hope that I've set the stage a little bit, in terms of some of these questions. Some of them could reach levels of pikuach nefesh, once again, where the person is suicidal, or alternatively, where the level of their mental health state is so severe that we would consider it pikuach nefesh even without it being suicide. I will discuss that. Or they're not suicidal, right? Or in cases of not suicide, where the issue is, more about functionality, about their ability to get out of bed, their ability to go to work, their ability to take care of the kids, et cetera, et cetera. How do we define all of these things? How do we tackle all of these things? Now, I've met rabbis who try or prefer to say that everything is pikuach nefesh, that everything is, life-threatening. I understand the desire to do that. Oh, yes, thank you, Yoel, 100%. Thank you. Yes, I forgot about eating disorders, but of course, you're absolutely correct. Eating disorders. Yes, of course. With regard, Asara B'Tevet, which are coming up, right? So, any of you who are dealing with eating disorders, of course, know the question. So, of course, anorexia at the top of my list, but also bulimia right up there, binge eating disorder, some ARFID that comes up, things like that. Yep, 100%, 100%. I definitely have many of those questions coming my way. And not just for that. Pesach is an example, but there's also others. Pesach and eating disorders, could be complicated. Changing your diet, kitniot, sometimes even chametz questions I get. I never before did I, until I dealt with mental health, I never got a question, can I eat chametz on Pesach? I've always been embroiled in the regular kitniot on Pesach. People have to have their rice, but it's a much more complicated situation where the person might actually have to eat chametz. So, anyway, but yes, 100% eating disorders. Poskim generally would prefer to say pikuach nefesh. Okay, why? It's easier. It's an easier category to use. If you say that everything is pikuach nefesh, then you don't have to worry what they can or cannot do, and you could just say, okay, it's life-threatening, and then you're done theoretically. Like once you've said that, you're done. You don't have to worry anymore. But it's not that simple for two reasons. Number one, factually, I'm not sure that it is pikuach nefesh in a lot of cases. When I first started fielding these questions, people came to me and they said to me, what happens if a person is cutting in a non-suicidal fashion? So I didn't even know that such a thing existed at the beginning. Cutting, it's not suicidal? What do you mean? Yeah. So I didn't even know that such a thing existed. And to me, it was like, as a rabbi, I was taken aback. This person is drawing blood. I'd say, oh, of course it's pikuach nefesh, or it could become pikuach nefesh. But when I spoke to the person I wrote the book with, Dr. Harris, Dr. Shmuel Harris from Machon Zvir in Israel, so he looked at me, he's like, I don't know, I'm not so sure, And it was like, what do you mean you're not so sure? The person's drawing, okay, not everybody who cuts is a pikuach nefesh. Sometimes they just do it in order to alleviate stress or whatever it is, or there's excoriation disorder, this and that. So to me, right, on the one hand, you say, oh, like, of course, this is, obviously it's a negative practice, but is it pikuach nefesh? Many times, factually speaking, the mental health professionals will say, I can't really tell you that it's pikuach nefesh. I can't really tell you that it's life-threatening. You might think, oh, this looks really bad. This seems really bad. It must be bad, etc. But they will say, no, I've seen 1,000 cases. It's not most, if not all of them, will not be pikuach nefesh. Okay, so then obviously that's different, And you could say safek pikuach nefesh. I understand what you're saying, And once again, I would like to say that, but I'm not sure that everybody would agree. I'm not sure even everyone here would agree, But okay, maybe. I definitely tried to develop the category of safek pikuach nefesh in my book because of the fact that I got many cases which I was hard pressed to define as pikuach nefesh directly, but also didn't feel comfortable as defining them, as not, right? So once again, I understand what you're saying I understand what you're saying about, not sure. Are you saying if you're not sure, there's a suffix. If there's a suffix, so suffix don't have it, etc. It's true and it's not true, right? That's why I wrote an entire addendum in my book about an appendix about what constitutes suffix pikuach nefesh. In other words, even within sfeikis, even within a suffix, some sfeikis are more than It's a suffix pikuach nefesh to get in the car too, but we get in the cars all the time and we drive. So what suffix do we consider to be a suffix pikuach nefesh that precludes us from doing something, or that constitutes suffix pikuach nefesh, and what not? Right? That's really the question at the end of the day. And here, there's a lot to discuss, and there's a Tzitz Eliezer and Rav Shlomo Zalman Auerbach, and there's a Moshe Feinstein, and there's a lot of stuff. And once again, we're not going to be able to cover even a little bit of that today. You'll just have to invite me back again. That's I guess what we'll have to have. But the point is that yes, there's a lot to discuss, over here in terms of those things. The second reason, besides the factual part, that even mental health professionals many times will not back me up on saying that something is a suffix or even a suffix pikuach nefesh, is that the person doesn't feel that way. And it's important for us to reflect to the person back also what they feel. It doesn't mean that they're always right. I'm not trying to say that, But yeah, sometimes when you say to the person, it's pikuach nefesh, they'll say, I don't even know what you're talking about. And that means they won't follow my psak, to be clear. Like if I am presenting their situation as worse than it is to them, they won't rely on it. They won't say, "Well, the rabbi said," so then I'll just be mekel, etc. If they feel like I don't know what I'm talking about, or that I don't understand their situation, then it will just fall on deaf ears. And maybe you've had that happen to you as well as clinicians, where you give a person a certain piece of advice and they feel like, well, I don't think you got it. I don't think you understood what I was going through. So I didn't do what you said, that sort of thing. And yeah, if we try to define everything as pikuach nefesh, it's certainly tricky and not simple. Of course, the other option, right, is to say that there is something between healthy and pikuach nefesh, something in the middle, a chole she'en bo sakana, if you will, something that just sick, has a fever, right, has an infection, whatever you want to call it, whatever the equivalent is within physical health, right? But you want to say there is such a category as well, and that'd be nice, if there was a category like that. I will tell you, I have devoted my time in the last few years in giving trainings to rabbis. So I've already trained. We've had like 7 trainings here in Israel, 2 in Australia, 1 in the UK. Still looking to bring one to America, God willing. But sometimes, not many times, sometimes I get feedback from some of the rabbis that I made it up. In other words, that the category of chole she'en bo sakana doesn't really exist for mental health, and that I made it up. Is that category, is that criticism fair? Yeah, I guess on some level it's fair. In other words, I agree that it doesn't state it explicitly in the Shulchan Aruch per se, or in the Gemara per se. I still think that I'm right that there is such a category, that there is a middle category, and I think that I can prove it, and I do that in one of my appendices once again in the book. But yeah, that's the other hardship, right? If you want to say there is such a thing as that there is only pikuach nefesh and healthy, then you can say that. If you want to say there's a middle category, I think it's more accurate in terms of describing the phenomena and what people are going through. I agree that it's harder in the sources, because you're not going to find anywhere that it explicitly states it. I think there's a reason for that. But you're not going to find anywhere that explicitly states that fact until the 20th century. The 20th century is the first time that I know that rabbis specifically mention, that there is such a thing. So all that is as an introduction. I'm going to spend the next 20-25 minutes going through some of the sources. Okay, that I do they have the sources? Do they get them or not? I know I give them to you.
You gave it to me. I'm gonna do an English language write-up. I can post it in the chat, or
No,
we
I'll
can
share.
share it on the screen.
I'll share my screen. Yeah, I'll share my screen. All right, I'm going to share my screen. To be clear, I'm not going to be able to read word for word, but I'm going to tell you what a lot of these sources say. Some of them I'll read word for word, but this is basically a very succinct attempt, okay, to summarize the basics of mental health in halacha. Okay, I'm doing my best here. It's not simple. It occurred to me that maybe before I share this, I should just make it bigger a bit. The letters. 1 moment. Sorry, just a second. Okay, here we go. All right. Now I will reshare. So like I said, it's a succinct attempt. I hope that it's relatively successful. Okay. We're going to talk first about cholesh sheyesh b'sakana, then about cholesh she'en b'sakana. I will try to tease out the principles from these sources and then sum it up. If there are any questions or queries at the end, we'll take those. Okay. So here we go. The first category, okay, that exists within the halacha is the category of someone who is physically unwell. As I said, the first case is the case of a woman who's pregnant, who's giving birth, and she wants a candle lit for her. Okay, so a woman who is giving birth is considered a cholesh sheyesh bo sakana, someone who's in pikuach nefesh from a physical perspective. And what we're saying is that any little thing, even a mental health concern, would allow for us to do even a deoraita, even a Torah prohibition on her behalf, right? As the Gemara here in Shabbos Kuf Kafchet says, right? Lo tzricha besuma, even a woman who's blind, right? And she wants a candle lit in the room, even though she doesn't benefit from it, but it puts her mind at ease that there's a candle lit in the room, right? That is allowed. Okay, and that's the Gemara in Shabbos Kuf Kafchet, and the Shulchan Aruch who paskins it in source 2. Yoledet hi kechole sheyesh bo sakana. Woman giving birth is like a chole sheyesh bo sakana. Mechalelin le'ashbat kol ma shetzricha u'mechal Shabbos for anything she needs. Korin lachachama mimakom lemakom u'miyeldin ota u'madlikin laner afilu yisuma. We bring a midwife for her. We birth her and we light a candle even if she is blind. And the levush here, or Mordechai Yafa in the 16th century, emphasizes in source 3. Even if the midwives don't need the candle, so they can do without it. But why are we allowing it? Because even if the midwives don't need it, but the woman giving birth needs it for her mental health, needs it to put her mind at ease. Right? That's what we're saying over here. So this is a significant statement on the part of the Gemara, and so we learn our first category. Our first category is someone who is, once again, physically a cholesh sheyesh bo sakana, and then even mental health concerns could exacerbate their condition, and we would allow even Torah prohibitions for those mental health concerns. Okay, another example of that is born in the Gemara in Baba Batra regarding. I'm not going to go into the whole source. But regarding doing a kinyan on Shabbos for a shchiv mirah is someone who's dying. So it's about doing a kinyan on Shabbos for someone who is dying, and the Gemara allows it because he wants to. He's worried that his assets won't go to the person that he wants them to go to. So the Gemara allows for this kinyan to happen, for this transaction. Shema titrof da'ato alav, which teruf da'at is another term that the Gemara uses for mental health or poor mental health. We're afraid that somehow, once again, he's a shchim mirah, he's dying, he's a cholesh sheyesh bo sakana. We're afraid that every little mental health concern might translate into something that is physically problematic from a health perspective. Okay, now we don't do a lot of kinyanim on Shabbos, and this is not so much of a relevant scenario for us, but it translates into something that you might maybe know much more, which is the question of whether or not, and the Or Zarua says this in source 5, whether or not you can send a runner to tell relatives that the person, his situation is worse than Nafshi. We use phones today, but before phones, right? If a person is not well and his situation is worsening, he might say to the doctors, I want my relatives to know what's happening with me. So can I ask this non-Jew to run over to the house and tell them? And the Gemara says, and the Or Zarua relies on this Gemara in source form of Baba Batra to say, yes, absolutely. כבר נשאל רבנו שמריה זצ"ל על שכיב מרע אחד, regarding a שכיב מרע, שמבקש ביום השבת שיהיו שולחים אחר קרובו אחד. שכיב מרע he asked if they can send to his relative someone to tell him what's going on. והתיר, רבנו שמריה allowed this. להזכיר רץ בשבת ולשלוח אחריו, to send after the person. כדי שלא תתערב דעתו עליו, so that his mental health does not become more severe, and as a result of that, his physical health, of course, would also follow as a result. And this is, of course, poskim in Shulchan Aruch in source 6. חולה דתקיף לעלמא ואמר שישלחו בעד קרובה, ודאי שרי, it's allowed. Now, there's an entire discussion here, all right, which I'm only going to allude to quickly, about the relationship between these two sources. We saw Gemara in Shabbos, we saw Gemara in Bava Batra. The Gemara in Shabbos discusses doing Torah prohibitions for someone who's dying, right? Lighting a candle, that's a Torah prohibition. The Gemara in Bava Batra talks about doing a rabbinic prohibition. A kinyan on Shabbos is rabbinic. Sending a non-Jew to do something on Shabbos on your behalf is rabbinic. Everybody knows that. So therefore, is there a distinction between these two sources? Are they actually saying two separate things? Are they disagreeing? Are they talking about different kind of realities? And there are differences of opinion about this. Some people believe that yes, there are two different kinds of cases. One case is where a person believes that the thing that they want done for them will aid in their physical health. The woman who's giving birth believes that if the candle is lit, it'll help the midwives do the job better. She's wrong, but that's what she thinks. That's what she thinks. That's what her perception is. She thinks I'll have a better birth, I'll be healthier, the baby will be healthier if there's a candle lit in the room. Okay, but the Shchiv Me'ra in Bava Batra, or the guy who's sending a runner, do they think that if they do that, they're going to get better? They don't, right? They don't do with that. A guy who wants his relative to know what's happening with him is not saying, if the relative knows, I might heal. You know, like that's not what's going on. You're dying. You're dying. You just want to make sure that all your affairs are in order. You want to do a kinyan, give the assets to whoever you want to give them to. You want to make sure people know, but it's not like you think this is going to help you. So if it's something that a person thinks is going to help them, that they can even ask to do a Torah prohibition. If it's something that is not going to help them in their mind, then the rabbis weren't as sure that you could allow it. And in that case, they allowed only a rabbinic prohibition for a mental health concern. Okay, only a rabbinic prohibition for a mental health concern in that situation. That's how some people read these two sources. The Tzitz Eliezer is an example. That's source 7. There are others who didn't agree with that. I brought here source 8, source 9, source 10, who all believe that this issue of Teruf Hadat is Pikuach Nefesh. They say so. The Levush, the Pri Megadim, and the Levush Yisrael, they all say it's Pikuach Nefesh. They don't say, oh, no. It's just a rabbinic issue because it's not Pikuach Nefesh, so we're not sure it's Pikuach Nefesh, so we only allow rabbinic things. Right? The Pri Megadim says, Af Bedin Torah. It clearly states it. In other words, that, okay, in that situation, what was needed was the rabbinic prohibition. They needed to do a kinyan. A kinyan is rabbinic. They needed to send a runner. Okay, it's rabbinic. They didn't need to do a deoraita. If they would have needed to, they would have done one, but they just didn't need to. That's all. So Seipel read these sources as saying, look, it's true that in some cases, in one case, the Gemara said only rabbinic prohibitions, but only because that's what was called for in the situation. Not because it's bedavka, not because you're only allowed to do rabbinic things. So there's a bit of a machloket here, about this category and what it means and how it translates halacha l'maaseh. And I brought here also some tshuvas, which once again, due to the time factor, I'm not going to be able to read. But source 11 here, the Shoel Umeshiv, who definitely applies this to all derabanans. That's another discussion that there is, according to the opinion that it's only with derabanans in certain cases. Is it all derabanans or just some derabanans? Etc. The Shoel Umeshiv is of the position that all derabanans were allowed, not just light derabanans, not just light rabbinic prohibitions such as amira legoy or kinyan, which are considered more light, but any derabanan is allowed. And only that, several derabanans, right, are allowed, not just one. Okay, that's his position. And brought the Imre David, who in source 12 basically states the opposite. Like once again, I'm not going to read it right now because of the time, but basically says no. They allowed something very specific, etc. So even within the opinion that the Rabbanans were allowed only, but not the Oraitas, even there are even people who are even more, they they limit it. And they say, even the derabanan thing, it's only with very light derabanan, it's only for doing a specific derabanan, but you can't just like get on a in his case, get on a train and do a million derabanans, like buy a ticket, carry money, tchumen, et cetera, et cetera, et cetera, go from place to place, it adds up. It adds up, and we're not going to allow all these things, like overtime. Either way, the point is that it's a big machloket. Also, Halacha L'maaseh, Rav Moshe Feinstein in source 13 allows only derabanans, not deoraitas. He holds like the chiluk that we said before. I'll mention that my Rebbe, Rav Nachum Rabinovich, from Maladumim, I learned in Maladumim, source 14. He paskins a little bit differently. That's because he takes into account certain concerns that I think that people were maybe less sensitive to in the past, and he believes we should be more sensitive to today. I actually heard this from him personally in a case that I had, where there was I'll tell this story quickly. There was a young man here on a gap year from Australia, and he called me up on a Friday and told me that his father, who was suffering from cancer, had taken a turn for the worse, and the doctor said that he might not last even a few days. And they said that if the sun doesn't fly back right now, he might not even be able to see his father. It was a Friday, and I remind you, Australia is the other side of the globe. So, therefore, when you're flying that way, you're flying with time, not against time. So therefore, basically, he would be flying through Shabbos if he flew on a Friday, and he would probably be landing there only on Sunday. That would probably be the scenario. Can he or can he not fly? So I called my Rebbe, Rav Rabinovich Zatzal, because it was like out of my league, that question. So I asked him the question. I said, what to tell the kid? And my Rebbe said, is the father still conscious? I said, as far as I know, the father is still conscious. So he said, if he's still conscious, he can go. So I said, why? So he said, because if the father hears that the son is on his way, then he'll make sure to stay alive for him. And you never know, like could be even like, even a few moments, of a person's life, it's like pikuach nefesh, and, the child should be able to go, for that purpose. And with the understanding that it has an effect on the person. Right? So here, once again, we have like I wouldn't call it exactly a mental health consideration. It's like a mental health evaluation more than a consideration. We're not worried about the mental health of the child. What if he's not there to see his father before he passes away? It's not really what we're saying, but it's like a mental health evaluation that the father might stay alive or try to stay alive more to see the child, et cetera, and stop himself from fading away if the child is on his way. So here, Rabinovich took into account, that consideration and allowed even a deoraita, in that situation. Look, at the end of the day, I think that there's no doubt that the Shevet Halevi, Rav Vosner, is right when he says over here in source 15 that it depends. It really depends on each situation, and you have to evaluate every reality for itself. As you say, there's no disagreement here. It all depends on what teruf hadad actually means. Yes. Okay, if there's a real chashash of teruf hadad, then of course we'll allow even Isur Torah. If there's no real chashash, then we won't allow it. It depends on the reality. I think at the end of the day, that's probably true. Different cases will allow for different kinds of things. And therefore, I'm not sure myself that the poskim are exactly disagreeing, because it might just be a reality-dependent question, and the context just needs to be explained, and then possibly all the poskim would agree. But when they say the words teruf hadad, they're just talking about different kinds of cases, so it's hard to know whether they're talking about the same sort of scenario, same sort of reality. The last thing I'll say in regards to this, and with this I'll end this part, is Rav Halpern's Tshuva in source 16, where he basically says something really interesting that we, once again, this is all like, newer stuff and stuff that we find out as we go, and I think you know this as well, that having a relative, not notified, but actually at the bedside of the person who's in the hospital, many times means that the care is better for the individual. So, all the poskim until the modern era talk about whether you can just let the person know that the relative is dying. But today, some poskim would allow more than that, not just to let him know, but for him to come. Because a relative that is sitting by the bedside of a person who's sick, many times will be able to achieve better care for that individual just by sitting by his bedside. Because the doctors will notice him more, the nurses will notice him more, he'll notice things that are going wrong quicker. Of course, once again, it depends on how bad things are, what the situation. I'm not saying any patient, anytime, I'm not saying that, but I'm saying, yeah, someone who is someone who's in a dicey situation, a complicated situation, yeah, someone who's sitting by the bed, helping that person out. I think many poskim would say, according to new research and things that are coming out, that it would be allowed even to do a total prohibition to get to that person, to be with them. Certainly, I've heard from Rabbi Eliezer Melamed, that that sort of psychological effect, when a person is rushed to the hospital initially, then yes, of course, a person should go with him, be with that person, through the first stages, because he needs all the attention he can get at that point, and absolutely. So, bottom line, I'm summarizing this part. We've seen when a person's physical health is at risk, we've seen several kinds of mental health concerns, which might even allow a Torah prohibition. One is if the person is concerned that not enough is being done for him. The other is if a person is concerned that other people don't know what's going on with him. A third is that the person might knowing that someone is on his way, right, could be a reason to allow a Torah prohibition. And the fourth, that even sitting by the person's bed might have an effect like that. But these are all different kinds of things, okay? And the point is that all of them have a mental aspect or a psychological aspect, right? But they're all considered, because of the physical situation, that it's already pikuach nefesh physically, then the accompanying mental health aspects take on the category of pikuach nefesh as well, in many of those situations. So I hope that's clear. And yes, Yoel also writes here a few other important things. Absolutely, thank you very much. So all that is category one. All that was one category of pikuach nefesh from a mental health perspective or with mental health applications. Okay, that's category one. Category two is pretty self-explanatory. I don't need to tell you this. I'm going to say it, but I'm going to show you in the sources quickly. But the second category is pretty simple. If the person is going to hurt themselves, right? So suicidal activity, self-harm, or harm of others, right? All these things could obviously be considered a pikuach nefesh or a safek pikuach nefesh. And this starts off with the Gemara in Ta'anit Kaf Bet Amud Bet, which talks about ruach ra'ah. And Rashi here explains that the ruach ra'ah that we're talking about is like a demon spirit, but the point is, what's more important to us is the effect that it has. Ratz veholech, says Rashi, person's running around, v'shema itba banahar v'yipol v'yamut, right? Because he's running around, he might drown in the river, he might fall off a cliff. You never know, right? For example, someone with, today what we call bipolar disorder, if he has a manic episode. So we all know, right? If a person thinks he's Superman, he might jump off a building, he might, he might run into the street, he might do all kinds of things. You never know with a manic episode what's going to happen, right? I mean, Rashi here seems to imply that it's a little bit involuntary. Person has a demon spirit that takes over him, and it's not exactly like that probably with mania, but it could be like that, or with schizophrenia, it could be a little bit like that, certainly. But either way, we see here that certainly ruach ra, which is also a code word or a term for mental health within the Gemara and the Mishnah, we see here this concern, that a person might hurt themselves. And the Hagahot Maimoniyot, source 19, talks about this also in reference to kashrut. Okay, regarding a person nichpa, the word nichpa at the beginning there is epilepsy. So I'm sure that some of you know that epilepsy back in the day was considered a mental health condition, not a physical health condition, because due to all the seizures and things like that. But either way, the point is that they thought it was a mental health condition, and the question was, could they give him something that's completely treif, sheretz ha'of? All right, could they give him something completely treif? Yes or no? And the answer that Rabbi Yaakov of Kurshin gives, he says yes, you're allowed to. Why? Just like Rashi said, right? Someone with seizures, he might suddenly fall, and something could happen to him. So therefore, yeah, of course, it's dangerous. And from here, the rabbis infer that anything that's a danger to him or to others, could be considered, of course, pikuach nefesh, as Rav Moshe Feinstein here in source 20 says clearly, if a person has a certain mental health condition that's very severe, of course, it's sakana. Not just to her, but also to the little kids. He's talking about like postpartum depression. Even if he's not doing evil on purpose, it could happen. Right? So in other words, yeah, it could become that way. It could become something very, very negative. Could become something very, very damaging to her, to the kids. She might try to hurt the baby, et cetera, et cetera. Once again, we all know this from the cases that we see, but the point is that here you see it. Rav Moshe Feinstein believes that such a thing is a sakana. So, but like I said, I don't even think we need really sources for this so much. I mean, there are other sources that I took out because I don't think we need so many sources for this. Persons are going to hurt themselves, hurt other people. Obviously, that's considered pikuach nefesh and should be treated as such. And that's category 2. Category 3, and we're getting to the end here, so I'm going to have to kind of like speed things up if this wasn't fast enough for you. Category 3 relates to the Gemara in Yoma over here, source 21. Source 21 talks about how do we know that pikuach nefesh is doche Shabbos. So I think we all know v'chai bahem v'lo shi'amut bahem, right? The famous drasha that says, we do the mitzvahs to live, not to die. But Rabbi Shimon ben Menashe has another drasha also fairly famous. V'shamru b'nei Yisrael et ha-Shabbat, chalel alav Shabbat achat, kedei she'ishmor Shabbatot harbe. Right? So in other words, Rabbi Shimon ben Menashe learns, you desecrate one Shabbos to keep many Shabboses. This could be a very important principle for mental health, because the Chai Bahem talks about a person's physical health. So on the face of it, it wouldn't apply to mental health, although you could also theoretically apply it to mental health, but I'm putting that aside. Chalel Alav is a great principle here because it talks about the spiritual gain. So in other words, a person is desecrating one Shabbos to keep many Shabboses. And that could be also very important for issues of mental health. Okay? So the Khatam Sofer, I'm not sure if I brought him here. I didn't bring him here. I brought the Minchas Asher, but I'm going to skip him for now. The Chasam Sofer in a tshuva talks about sending a child to a school or to an institution, which will help him not be a shote. Right now he's like the status of a shote, but it will help him to become like more of a mensch and someone who can handle himself in society. And he applies this idea of Chalel Alav, the Chasam Sofer. He says, maybe we should send him to this institution, which of course in his time, there was no option for like kashrut or anything. Like he'll go there, he'll desecrate Shabbos, he'll eat treif, he'll be in this institution, etc. But is it not better for him to do that and become a pikeach, become someone who's chayav in mitzvahs, rather than stay someone who's not chayav in mitzvahs all of his days and never be able to mekayim anything? So he says, yes, on the face of it, that is So it's a complicated tshuva. Not clear exactly what he says at the end. But a lot of poskim that came after him agreed that yes, when a person is a proper shote. So what's a proper shote? This is another shir that I can't give right now. But a proper shote, according to halacha, mania or psychosis. Okay, so we're talking about the extreme end, right? In those cases where there's like a certain extreme presentation, where the person is a shote, is pater mina mitzvahs, is exempt from keeping mitzvahs to that extent, then it is better for that person to desecrate. It's like the pikuach nefesh. It's better for that person to do Torah prohibitions and get better than to stay in the situation where he's exempt from all mitzvahs. All right, that's the third category of pikuach nefesh in mental health. So in other words, the third category basically says even if the person is not physically cholesh yesh bo sakana, even if the person is not going to hurt themselves, even if the person is not going to hurt anybody else, even if he's totally tame, but his situation is such where he's exempt from keeping mitzvahs because he's so far gone, and we can treat him in a way that will bring him back to being a bar chiyuva, to being chayav in mitzvahs, being obligated. Yes, you could do even the oraitas. I have a quote from Rabbi Yashiv, that he once said that, to take a person, to feed him tray food so that he can transition from shote to not shote, even if it's just for a few hours, worth it. Yeah? Because as a shote, it's as if he's dead, halachically. If he's not chayav in mitzvahs, then his nefesh is dead. And it's pikuach nefesh of the person to transition to a situation where he's no longer a shote. I'll say one last thing, and with this we'll end for today. I couldn't do a cholesh she'en bo sakana, which is the next part, but I'll say one last thing about cholesh she'en bo sakana, and then I'll open up for whatever questions or comments you may have. Although I do want to also apply it to the cases. So let's just say a word about cholesh she'en bo sakana. Cholesh she'en bo sakana it basically goes to functionality. Okay, that would be the yardstick that I would use to evaluate it. Okay, if the person is affected functionally, meaning they can't get out of bed, they can't like a person who's sick with a fever, right? So he's a cholesh she'en bo sakana physically because what? Because it affects him, right? He can't go to work, he can't do certain things. He's not as functionally active and capable. So if the same, what does it matter to me? Mali hacha mali hatam. What does it matter if the person is, it's because of a fever or because of a depression? At the end of the day, it affects the person functionally. Then it would be considered to be a cholesh she'en bo sakana, without a doubt. And that's generally the yardstick that I use. Okay. And then what's the halacha with a cholesh she'en bo sakana? So the halacha is usually we say you could do derabanans with a shinui. Yeah, that usually is the halacha for a cholesh she'en bo sakana. If a shinui is not possible, some poskim allow without a shinui. Some poskim allow a deoraita with a shinui for a cholesh she'en bo sakana. There's a discussion about sakanat evar, Rabbeinu Tam, others, etc., who discuss that. So there's a lot to work with in terms of understanding what the halacha would be for a cholesh she'en bo sakana. But in terms of the definition would be someone who is affected functionally by their mental health condition. Okay, so many times with OCD, I see cholesh she'en bo sakana. I've seen once or twice an OCD case which is cholesh sheyesh bo sakana. Where they're mamish doing things that are hurting their health in a way that could be detrimental. There was a young woman who used to put bleach on her body every day, gallons of bleach, and the doctor said that she would kill herself literally if she continued with that, etc. Due to her OCD. That was definitely cholesh sheyesh bo sakana, But a lot of the cases of OCD are cholesh she'en bo sakana. With depression, it depends, on the case. I've seen both kinds. I've seen cases where I think it's a cholesh sheyesh bo, cholesh she'en bo. If it affects them functionally, for sure I say cholesh she'en bo sakana. Most cases of depression, I would say, that are clinically diagnosed as such, are cholesh she'en bo sakana. and sometimes they arise a chol sheyesh bo sakana. When I spoke to Rav Herschel Schechter, he generally erred on the side of caution with this. Like he saw every depression almost as a chol sheyesh bo sakana. And his position was very much in that direction to say, oh, it's all chol sheyesh bo. It's got to be very careful with depression, et cetera, et cetera. Once again, I'm not sure clinically that everyone would agree in every case, but that was his general inclination, is to go in that direction. Cases of trichotillomania. Once again, the person is not in bed, right? But he's cholek kol gufo. The Rama says cholek kol gufo afilu mitalech kebari. So if a person is functionally affected by the trichotillomania, so let's say that young woman, right, who told me that she was pulling her hair, she had bald patches all over the place, and she couldn't go out of the house. She couldn't go to work. She was embarrassed. She couldn't go out of the house. She couldn't go to work. She couldn't see friends. She couldn't do all kinds of things. Yeah. So I thought that she was definitely a chol. It wouldn't allow deoraitas. I couldn't tell her she could sew on Shabbat. I had to find other options for her. But nevertheless, we had to. I think that the definition for her was definitely a chol she'en bo sakana. There are cases where I say not even a chol she'en bo sakana. If the person is functionally okay, they're bothered, but they're functionally okay. They're managing, et cetera, et cetera. So of course, like a person who has a bit of a headache and they get out of bed and they're fine, et cetera. But they're not fine, but they're managing, So bottom line is, it will depend. The application will depend on the case and on the situation. So I'm going to stop here, I think, and I'm going to let if there's any questions or comments, happy to take.
At this point, anyone in the audience is before I steal the mic and ask my questions, if there's anyone in the audience that would like to ask.
Yeah, I agree with Yoel's last point there about chol she'en bo sakana. Always allow medication on Shabbat for sure, absolutely, and not only on Shabbat, also on fast days. Yeah, 100%.
So you just to see if I understand this, you kind of recognize that the chol she'en bo sakana is more of a phenomenological definition in halacha. There's different wordings of it. Nofel mishkav. There is, I think the broadest is in the Aruch HaShulchan, where he describes someone that's just not able to leave the house. They would have a migraine or something like that, and definitely someone with a depression, anxiety disorder would fall into that classification. And I guess in those cases, you would be allowed to treat them like any other chol she'en bo sakana. You'd allow them to take medications if they need, even if they're starting a medication, or even to go to the pharmacy and maybe ask a guy to pick something up for them on Shabbos. Definitely allowed to call into their psychiatrist or call into their care team. I guess you mentioned at the beginning of your talk that not everyone agrees with that assessment. What is the state, so to speak, of the acceptability of that standard within the halachik discourse, and kind of how has that been received in the rabbinic community?
I mean, it's more of a definitional question than a practical question. Okay, but let me explain briefly what I mean by that. Okay, look, for the book, I tried to go to as many poskim as I could. Okay, from as large as a spectrum as I could. From the Haredi world, I went to Rav Asher Weiss, and I went to Rav Zilberstein, Ritzach Zilberstein, and I went to Rav Eliyahu Bar Zil from the Sephardi Haredi rabbi, Rosh Hashanah Beit Din of Yerushalayim. I went to Rav Yuval Sherlo, I went to Rav Henkin Zatzal, Rav Rabinovich Zatzal, Rav Melamed. I went to Rav Rema Cohen from Othniel, to Rav Gigi from Haretzion. I went to speak to Rav Herschel Schechter, to Rav Mordechai Willig, to Rav Yaakov Ariel, to Rav Dov Lior. My Rebbe Rav Shilat from Maladumim as well. I'm not sure if I'm forgetting anybody, but I really did my best to ask as many Rabbanim as I could. Most of the Rabbanim that I spoke to agreed with the designation of chol she'en bo sakana. But I can't tell you that everybody agreed with it. Some people didn't agree with it. So what do they do? So the answer is they kind of do diagnose, in a sense, a chol she'en bo sakana, but they do it on their own terms. They don't believe in the term. They just believe in the psak. In other words, they will basically paskin for that person something middle-ish. According to what? According to their svara. Meaning they'll look at the person and say, here's what you need. So then I'll give you this. You don't need to go further than that. You don't need to do a deoraita. So just do a derabanan. But they won't call it a chol she'en bo sakana. They won't claim that the designation exists. in and of itself. Okay, they'll just say that they can poskim as if it's a chol Hashem without the designation. So I think that lemaise, the daylight between the two positions is not practically so significant. Okay, but on a definitional level, there's a difference.
And now going away from the rabbinic sort of community and its acceptance, what do you think the barriers are maybe for patients themselves? You brought up a really important point that, patients that are experiencing mental health issues have a harder time identifying with Orthodox Judaism just because, they have their own challenges. I can imagine a type of person or type of family member that might say, you're just trying to find a way out. Is there a way that we can sort of push the envelope, so to speak, so that people and their care, persons, whether that's family or others, can recognize that this is not just in your head, so to speak, but it's halachically recognized and also medically recognized?
Yeah, I mean, that's what I'm trying to do. That's the whole thing. In other words, the whole thing is exactly that. Because I always say, and I'm saying this in short because of the time, when we halachicize, we destigmatize. In other words, when something has a halachic answer, it's also less stigmatic because it's real. It's real enough that I'm letting you do something on Shabbat, or I'm letting you do something on a fast day, right? If it wasn't real, if I didn't believe it was real, then I wouldn't allow you to do that thing. So obviously, I believe in this thing very, very much. So halachicizing this field is imperative for people to feel like they can, like they're seen, they're understood, they're not transparent, and B, that they can live an Orthodox life. I don't know. I've never met the off the derech guy that says that the reason he's off the derech is because he had a physical issue and he thought didn't work out with the halacha. I never heard that story. Yeah, everyone who has physical complications knows that they can deal with them within the confines of the halacha, and they'll get healthy if they need to get healthy. But with mental health, it's like not obvious. So therefore, people leave orthodoxy behind a lot of times and say, "Oh, I can't deal with this with both of those things." I'm saying we need to deal with both of those things. We're able to find a bridge between those things. We're able to find a balance between those things. I think it will help people, like I said, feel more seen within the Orthodox community and also feel like they can live an Orthodox life.
All right. Thank you so much. Just one last time, Nafshi-Bisheelati, it's a great read. I put the link to the Amazon in the chat, and I'll put it in the show notes that will hopefully go out soon. Important read, and I can't wait to see its acceptance, when you come out with the English version as well. I hope the audience doesn't think that we're trying to summarize a 500 plus page book within a single talk. And of course, a good talk is always an excuse for another good talk. Thank you so much for your time, Rabbi Rosensweig.
Thank you.
All right.
Laila tov.
Laila tov.